You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with sleep apnea or chronic snoring. And especially for those of you that are wearing CPAP or refuse to wear CPAP, you have to hear what my first guest has to say. He's getting amazing results with his clients. We're with his patients, Dr. Richard Drake. Dr. Drake, welcome to the program.
Thank you, sir. Nice to be here.
Now, so it works, what you're doing.
What works? What do I do? I provide dental devices to treat sleep apnea for snoring and obstructive sleep apnea. I've been doing that for well over a decade now.
Okay, good. Now, for people that don't know your center, tell me a little bit about your practice. I guess it's very unique, right? Because this is all you do?
That's all I've done for over 12 years now. So
people with chronic snoring and sleep apnea?
That's right. My wife chipped a tooth the other day, and she came in and she sat down in the chair, and I said, where is it? I couldn't even see it. You know, it's been not long since I've done a filling. Even though I'm a dentist, that's what I was trained to do. So can I tell you about how I got started in this?
Yeah. How did you get started?
It goes back more than a dozen years ago. I went on I'm a big fisherman. Fishing is my passion. Okay. And I went to the Amazon basin to fish for peacock bass, a trip of a lifetime if you ever get a chance to go. And I'm spending a week in a tent with this guy, sleeping a couple of feet from him, and or trying to sleep, I should say, right? This guy snored so loud he scared the monkeys away at night. And my gosh, you know, I said, how does your wife sleep with you? He said, well, we haven't slept in the same bedroom for, over a decade now. And I'm thinking, that's kind of weird, you know? And I went back to San Antonio. A couple weeks later, there happened to be a course on sleep apnea in San Antonio. As a dentist, I didn't even know what sleep apnea was 13 years ago. So I take this course for 4 hours one evening. I come home and I look at my wife. She says, how was the course? And I said, life-changing. And she looked at me and said, well, that's kind of weird. Usually it's, it was okay. We did this, we did that kind of thing. And she said, well, what do you mean? And I said, well, I'm going to put my dental practice up for sale tomorrow.
And just do this sleep apnea business.
Well, you can imagine the look I got.
Okay.
She said, "You're going to do what?" I'm going to sell my practice, and I'm just going to concentrate on treating snoring and sleep apnea. I want to learn how to do this and be the go-to guy. And what did she ask me?
What's that?
She said, "Are we going to have to move?" I really like our home. Well, 13 years later, we've not had to move. In fact, we've upgraded our home because of certain things that have gone on and things like that. And I'm a passionate guy about this, and I enjoy doing what I'm doing and helping people.
Good. Now, at the top of the show, I said you say no CPAP. And I asked you in our green room over there, I said, have you ever taken anybody that had to use a CPAP for sleep apnea or for chronic snoring and get them off their CPAP? And you said?
Every day.
Every day.
Every day we do that. And the challenge with CPAP is, and we don't want to talk bad about a therapy that helps save a lot of people.
Right?
It does work, but you have to wear it. And that's what's difficult is people have a hard time wearing it. When we look at the big studies that cover thousands of people over a decade. There are some of these studies out there. And then we look at treatment outcomes for what happens with patients when they do different types of therapies and treatments. And we're seeing the same results with the dental devices that we've seen with CPAP because patients will wear a dental device. It's much easier to put in their mouth and do things like that. It's not as burdensome.
You wear one.
I do.
Is that right? You brought yours.
Can I put it in?
Yeah, go ahead. Yeah, I was hoping you were going to put it in.
You sure?
Because I've heard that these are very uncomfortable.
Who told you that?
Somebody told me this. Some negative dentist actually. He said, well, Randy, the problem, he didn't know anything about it, but he said, I think they're uncomfortable.
And you know what? Can I toot my own horn a little bit here in the sense that oftentimes patients go to a dentist and they don't do a good job of fitting the device, and it is uncomfortable. So you need to see somebody who has experience doing this. I've been doing this for over a dozen years. I've treated thousands of patients with this device.
I mean, you probably treated more people, according to your bio, than just about anybody for sleep.
I think so.
Yeah.
Yeah. So you don't mind.
Okay.
Here it is. One goes on top, one goes on bottom.
Let's take a look.
Put the top in. Put the bottom in.
And that's it.
That's it.
Okay, so let me get.
You want to try this in, see if it fits you?
No, thanks.
No,
No, thanks.
okay.
But so I get this correctly. Okay, so people that are chronic snorers, I'm going to group them together because I know they're two different things you say, and sleep apnea, but they're breathing fine during the day. So these people breathe all day, but when they lay down, they're what? They're like their jaws dropping back a little bit, blocking the airway? Is that kind of what's going on?
That's absolutely fair to say. We don't make that snoring sound right now.
Yeah.
So I've been told I snore at night, okay, by my wife. How come I'm not snoring now while I'm breathing?
Yeah.
I'm awake, I'm upright, I have more muscle tone, things like that. So when we go to sleep and we relax and everything starts to shut down for the night because I want to get a nice refreshing night of sleep. I've got these big lungs here and I'm trying to get air through that little space in my airway, and when my jaw falls down and back, I can completely close
so this
my
just
airway
holds it out there.
Yeah, if you think about my upper teeth, my lower teeth, and I'm going to open a little bit and I'm going to move my jaw forward. So we kind of have this sweet spot out here.
It seems so simple, by the way. And I'm not trying to side with you. People need to know it's a real interview. And I'm not endorsing you on this program, but it seems simplistic.
It does, doesn't
because
it?
Because if so many people have this, and their options. Okay, so if you're a chronic snorer, you have sleep apnea, you have the CPAP that they know it's proven to be effective, that forces air down your. Is that right?
Yeah.
Or you can just do this, and you've had pretty good success, would you say, with this?
Yes.
Like, have you treated over 100 people with CPAP that now are no longer wearing CPAP?
I'd say more than 1,000. We've treated more than 1,000
Interesting.
patients who were on CPAP and using CPAP. And then we get them off their CPAP so that they use a dental device only. The bigger market of this, okay, is people who couldn't wear CPAP in the first place.
All right.
That's the market.
Like who? Some people just can't do it?
Well, last year there were 824,000 CPAP machines last year sold in the United States that have not been turned on since they made it home. So now they're a cup holder. Now they're holding my dental device, which sits on top of it, next to the bedstand.
Look, if people are wearing CPAPs, nobody wants to wear their CPAP, right? Is that true?
There's a few.
I mean, it makes them feel good because they wake up, they slept, but
yeah.
The idea is do you think if they all knew about this and got the result, I mean, there would be no more CPAP.
I don't know about that. I mean, I'd like to think that, what we do is more simple. That's the beauty of it, okay? That we simply grab a hold of people's jaws. It's difficult to do if you don't have any teeth.
Oh, okay.
For example. So,
I gotcha.
So there is a percentage of people out there that I think the most important thing is to understand that we will help you do in my office, okay? Is we're going to figure out what works best for you.
Okay.
Which may or may not be the thing that works the best for me. So I sit down and I will consult with the patient and I'll spend 30 or 40 minutes with them and I'll review their medical history. I'll look at their bite, where their teeth are. We look at how big their tongue is. We look at how narrow their jaw is. Is their bite shallow? Is it deep? Do they grind their teeth at night? We look at all of these types of things to determine, number one, are they a candidate for dental device therapy?
Okay.
And number two, which particular dental device should we make? And that's part of the difference between the experience that I bring to this that your typical dentist may not understand and know. Okay. And I understand most of those things because I've made most of those mistakes, in the past.
Why is this your mission?
That's a great
Where all
question.
You want to do is talk about it, you lecture, you're on the road?
I think at some point a light bulb went off and I just thought, it was so rewarding to change people's lives. People come into my practice.
Yeah, how are you changing their lives? Because you've said that a few times on the phone to me.
They're sleepy. They're tired. They're sick and tired of being sick and tired. I mean, when we think about the average patient who walks into their primary care physician and he says, man, I'm just tired, I'm sleepy, I don't feel good, because I don't feel good, I don't go to the barbecue with my wife
Okay.
In the neighborhood that weekend. I fall asleep at the movie with my wife sometimes, and I've been known to fall asleep just talking to her, while she's talking to me at night, and she sees that as, well, I'm not interested in her, and the reality is I'm just tired. I'm sleepy.
So they think they're sleeping and they're not sleeping? Is that what's going on?
Yes, most people.
So they're laying in bed for about 8 hours, but they're not sleeping, you're saying?
Well, what happens, can I go back just for a second about these people that come in that are sleepy and tired, and how we change their lives is, number one, like you said, we go to sleep at night and we wake up in the morning, and sometimes we feel good and sometimes we don't. But we don't understand that our sleep staging, we go from a deeper sleep, right, where our body becomes more relaxed and everything relaxes more, and then our airway closes down.
Okay.
So I'm trying to breathe, but I can't get air in. I don't wake up, but I go from a deeper sleep to a very, very light sleep. So the overall effect would be no different than me just reaching over and kind of pinging your ear, every 30 seconds or every 60 seconds.
And they do sleep studies medically.
Yes.
Your patients.
Yes.
And you could show a before and after? That means, I guess they're waking up like 100 times a night?
Or more. In many cases, sometimes it's 100 times per hour.
And they don't realize this.
They do not understand what's going on. They just live the effects of being sleep deprived.
So they're tired all the time.
Tired all the time. Sleepy, grumpy. I mean, what happens to any of us when we don't get enough sleep?
And I know I'm jumping ahead, but you make a custom fitted mouthpiece.
Correct.
Bring their jaw forward. Now they could breathe. They're sleeping. And the after effects are what?
Well, people, I've engaged life again.
Okay.
I feel better about what I'm doing. I have more energy. I had a guy the other day, he was there with his wife, and they came in, and she said, I want to thank you, Dr. Drake. We got rid of the yard man, okay? Who was mowing our yards. You saved me $100 a month,
Okay.
I looked at Jim, and I said, sorry, Jim, you're back to mowing the yard again, right? He said, yeah, but I enjoy it. He said, I just didn't have the energy before to do that type of thing. We see people whose lives simply become more productive because they sleep better, because they oxygenate. Think about what happens when our airway closes down and we're not getting oxygen.
Well, I know what happens when I don't sleep. I mean, you feel lousy. You're not motivated to do anything.
Right.
Interesting. This is interesting. So what's the challenge for you as a doctor that's treating people, chronic snorings, is to get them to believe it's possible, that it works?
I think...
Is that your challenge?
I think the thing that bothers me the most is I work in a dental office where we have patients come in and they get their teeth cleaned and they do that. And the guy is while he's getting his teeth cleaned.
Oh, really?
Yeah, he's snoring. Or the guy in the waiting room is snoring. And then I walk in there and I go, hey, Jim, it's good to see you again. We're screening for sleep disordered breathing now, and I notice you're a little tired and sleepy. I'm not that tired.
Okay.
Right? We call that stubbornness in Texas, right? I'm not sure what you call it in other parts of the country.
Okay.
But I'm not tired. And I get a little bothered by that patient that I know has sleep disordered breathing, and he is living a less productive, more miserable life for the most part, right? Because he's grumpy and he can't remember things anymore, and he has mentation issues, and all of these types of things. And then he's stubborn. That's my biggest challenge, is just looking at that.
You say the wife or the spouse, the partner, or whatever, sometimes has to drag them in.
Yeah, literally drag them in.
I mean, they sleep in separate rooms, you say. Yeah. You'd have to, I guess, if you're. I told you, I've been around one guy that slept, that you couldn't sleep around him. We were on a school trip, and he had to sleep on the top deck of the ship because it was so loud. So I guess they can't sleep with their partner.
Yeah,
right?
and that sometimes goes back to this engaging life type of thing.
Okay.
Well, we get people. I want to go on a church retreat with my girlfriends. I went last year. Guess what? I didn't get invited back this year because nobody can sleep in the cabin with me because I snore so loudly. That's embarrassing, number one, right? Number two, but that's ways that we change people's lives. We get them back into doing things, and you know, the more you do, and the less you do, the less you do. I mean, it sounds simplistic, but the more we engage life and we do those types of things, and that's the most rewarding part about what I do, is we take patients who, the analogy I use is, I'm sleepy, I'm tired, I don't engage life as much, I'm a little more depressed. Medically, every time I go to the doctor, my blood pressure's getting worse. Now, they just told yesterday I have type 2 diabetes. And it's like this vicious little spiral downward towards death, so to speak. And as we're doing that, and we're not getting air into our lungs and oxygenating our blood, our brain becomes starved of oxygen. It's no different than being at the bottom of a swimming pool. And you better breathe, Rich. You better breathe. You better breathe. You know, at some point I have to do that. So my brain gives my pituitary gland a signal, give me a squirt of adrenaline. And that adrenaline is what? It's the fight-or-flight hormone, right? The bus falls over on the kid, and the mom runs over and picks the bus up and, you know, pulls the kid out. But think about that happening 100 times every hour. At night, that same squirt of adrenaline.
So that goes away when you get them sleeping?
Yes.
You say they lose weight? Some people?
Everybody, for the most part.
Loses weight.
Yeah, and that's part of that cycle downwards too, where we talk about the weight gain and things like that. You know, have you had trouble losing weight in spite of eating less and exercising more? So we know that one of the comorbidities of sleep disordered breathing and sleep apnea, and even snoring, is my ability to metabolize glucose, my ability to produce insulin. So these types of things, now I start to have the weight. And then what came first, the chicken or the egg?
Yeah.
I believe it's the bacon, by the way, came first.
You know, we have medical doctors on this show, and they say, Randy, if we can't get people to sleep 6 or 7 or 8 or 10 hours, they're not going to live a healthy life because of stress hormones. And
that's exactly
what do medical doctors, do they refer you people ever?
Yes.
They do?
One of my biggest referral sources is from what kind of doctor, you would think? You think a sleep doctor, right?
Okay.
No, this guy's a rheumatologist. We call him Dr. Itis.
Okay.
Because everybody in his practice has some kind of arthritis or something like that, right? And in his practice, you can't say the F word, which is fibromyalgia, right? So when we think about people being sleep deprived, what happens? I hurt more. I ache more. You know, I'm sitting at home. I can't get up off the couch. I need to go mow the lawn, but I don't feel like it. I should walk around the block. You know, so I'm tired, I'm sleepy. We have this increased cortisol. We have these increased catecholamines, this increased sympathetic tone. I mean, what are we seeing in the bigger picture of things across the United States right now? We're seeing these diseases happen to people at earlier ages than they used to.
Okay.
It's almost like we're fast tracking these people towards death in a way. And that's what we're trying to reverse.
And you see it though every single week. You see people that, and I said this, and I thought you were exaggerating, and I don't even know, maybe you are exaggerating, but you said that, I said, have you ever had people that have called you and said that you've changed their life? Or called you and said, you know, I should have done this years ago. And you said every day.
Every day. Every day people call. The next day they call. We give them this simple dental device, and at night they put that thing in, and they call the next day and they say, my gosh, is Dr. Drake there? You know, he's with the patient, right? Can you tell him I have never in my adult life waken up and felt this good. I cannot remember the last time that I went to bed and I woke up and I thought, holy cow, it's time to get up. And I felt like getting up. And I jumped out of bed and I got dressed and I went out to conquer the day.
So it's a happy group of people.
Happy.
What's the fastest turnaround you've seen? Where somebody that was a chronic snorer or on a CPAP.
One night.
Is that right?
One night. Changes their life.
And spouses, do spouses call you, by the way? I'll back you up for a second. I mean, did they ever come in and say, you know, thanks?
Yeah, a little older couple comes in the other day, And I thought, man, I wish I'd had a video camera in my office doing this. And they came in, and she was almost giddy. She was like, "Oh, Dr. Drake," and they came in, and they were arm in arm, and they're doing this kind of thing, and and she's like something's going on between these couple. Well, they've been married 40 years, and this guy, he looks at me, and he just says, "I got to tell you, Dr. D, I was a little bit skeptical when I came in here." Okay, I'm sitting there and I'm looking at this little piece of plastic that you're trying to, quote, sell me on this stuff. And I thought, I don't know, but my wife, we want to sleep in the same bed again, right? She can't because of my snoring and that stuff like that. And I thought, well, I'll do it for her. That's what he said. He said, well, here it is 2 weeks later. Okay, I didn't do it for her. My gosh, has this just changed our lives with how I feel? I just feel so much better.
People that, I was watching Oprah back when she was on her regular show. So people aren't sleeping in the same rooms. You think snoring is a big part of it? Is that where it starts? I mean, you hear the stories. I mean, you're in a unique situation. People are coming to you. Have you heard stories of people moving back in the same room again?
Sure, every day. Every day we hear that.
Every day?
Every day we hear that. And it's very rewarding as a dentist to be part of this. I mean, I do not in any way want to belittle what most of us as dentists do. We fix teeth, we make smiles.
Okay.
We add to this charisma of people, and I look good and I feel good. There's nothing wrong with that, okay? But the last time I checked, you got to breathe to stay alive. And you have to sleep to stay alive too. People are concerned that they're falling asleep while they're driving. They're sitting at a red light, honk, honk, somebody honks behind them.
Do people really do that?
Big survey, 10,000 people, 1 in 4 admitted to falling asleep behind the wheel within the last year.
And these patients that come and tell you this?
They're sleep deprived.
Surprised.
Can we change their lives with this little piece of plastic? Yes, we can. We get their jaw forward, we get their tongue out of the way, we open their airway so that they oxygenate. I get oxygen to my brain. I think better. I think more clearly. I remember things better. I get oxygen to my heart.
You could spot sleep apnea people. Your wife visited the green room, and she said that you're walking around with her sometimes. You say, I bet that guy has sleep apnea. Wow. How do you identify these people?
Well, older, little heavier. Although 1 in 4 people who have sleep apnea is skinny.
Okay.
Right? So we have to be careful about how we say that. But we get bigger necks, right? We're all getting
and they look tired.
Bigger. I think that's the biggest reason. I do these talks, and we go to local clubs and things like that, and I'm Dr. Drake, and I'm doing this talk, and there's 20 old guys out there, and the only guys that need to hear me are drooling on themselves, because they can't even stay awake. And people don't understand, I think, how tired they are sometimes. And I think that's kind of what bothers me, is that people are suffering from something needlessly. They don't have to live their lives in misery like they are. And sometimes they don't know it. And you think about relationships, does this really help my relationship with my spouse? Yes, it can. Because I engage life again. I talk more. More things come out all the time.
Now, we are out of time. Sorry to interrupt. Somebody watching this, okay, maybe it's the spouse or the partner or the wife. They're at the chronic snoring stage. Maybe they're not sleep apnea yet. Why should they come in early? Why should they come in?
Because they're going to feel better.
Okay.
Because medically, they're going to shorten that list, that trip to all of the negative side effects of sleep apnea. And we're going to help them feel better, be more productive, have more energy, all of those things.
Now, for people with the CPAP, because medical insurance covers a portion of the CPAP, what about this? Probably not, right?
No, medical insurance covers this.
For a dental product?
Yes.
Okay.
But again, the dentist that you see, this is why one of the reasons we are successful at doing this, is we work with your medical insurance. I am in network with many of the medical providers.
But they have to get one of those sleep studies to qualify, obviously.
Yes.
Which you want to get anyway.
And we can help them do that as well.
Now, medical doctors will watch this show. What do you want them to know about what you're doing and what you could do for their sleep apnea patients?
I want them to know that patients have alternatives to doing this. 30 years ago, we started with PAP, positive airway pressure, and most physicians, that's all they know. There aren't that many dentists out there that know about this. That's why I partner with a guy and we teach dentists to do this. But
do you have more than one medical doctor that refers you patients?
We have 100 medical physicians who routinely refer us.
When were you going to mention that part? I'm just giving you a hard time, by the way. So medical doctors have adopted this as mainstream, as that it works.
I think we're making that transition.
Okay.
I think we're in the middle of that now, because medical doctors, they might refer a patient to go back to his dentist to do that. And that dentist doesn't deal with medical insurance.
Okay.
So that doctor thinks, well, they don't cover it. And the reality is they do cover it if you know what you're doing. We know what we're doing. We have streamlined this, okay? We want to get patients in sooner. If you're sitting on the couch and you're tired and you're sleepy and you have some of these medical comorbidities.
And if you're snoring so loud you can't sleep in the same room with your spouse.
Right.
Come in. What do they want to know? Every time they come in on that consult, what do they say? Like, what are the top 2 questions?
Does it work?
All right.
Yes, it works. Research is unequivocal.
Okay.
Peer-reviewed studies, if you put that dental device in, and again, you titrate it to find that little sweet spot, that's what's important. That's why in my office, we send you back for a follow-up study to make sure that it's working. We put some science behind it. We're not just guessing.
Okay.
Yes, it works. But you've got to wear it. You've got to get over that hump. Some people will say, well, it can hurt my jaw a little bit. It can change your bite.
But you get used to it.
Yes, you get used to it. That's the bottom line.
What's the second question they always ask?
Does my insurance cover it? And we just covered that. Yes, it does.
Yes. So there's no reason. They have no excuse.
No excuse. I like that.
Okay. I want to thank you for coming in. I mean, great information. If people want, and as far as the consultation, free consultation?
Yeah, we don't charge for consultation.
Do they get to see you?
They get to see me.
How long does that consultation take?
Sometimes it takes 10 minutes and sometimes it takes 40 minutes.
You say you get excited on some of these consults.
Sure.
About what?
Well, I see a guy and I'm thinking, my gosh, this guy's a slam dunk. I look at his bite, his tongue, I look at that and I think... And
you hear his miserable story.
Yeah, I hear his miserable story and I think, man, we can just get him over the hump of just getting used to this thing, which takes 5 to 10 days.
All right.
And then I might get used to it and I don't have any problem. And then we just tweak this thing. We're going to hit that out of the park.
And then he has more energy. He's running and hiking and...
Back to mowing the yard again.
Back to mowing the yard. Thanks again for coming on the show. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.